I'm sorry, but you have the beginning stages of fatty liver disease. It's a condition we need to manage carefully.
Oh no, my worst fear has come true. But I don't understand how exactly I got fatty liver disease in the first place. How could this happen to me?
Fatty liver disease can develop from habits like diet and lack of exercise. But we should really talk about something: the use of herbal and dietary supplements, or HDS.
Aren't those supplements supposed to be good for you?
In some situations, yes. Lots of Americans use dietary supplements, like herbs or synthetics, especially if they lack certain nutrients. But not all are safe, especially for your liver.
I've taken some for energy and weight loss.
That's common, but here's what you need to know. Liver damage from certain supplements is becoming more common. For example, bodybuilders using supplements have reported symptoms like itching and jaundice, which are signs of liver issues.
What should we do about this?
Let's start by looking at all your supplements and how they affect your liver. Then, we'll create a plan together, focusing on diet, exercise, and maybe medication. It's a journey, but I'm here for you.
Thank you, Dr. Reyes. Having my mom here and knowing you're supporting me makes this less scary.
We're in this together, Valerie. Now let's talk about another habit that could harm your liver: smoking. Do you smoke?
Yes, I do. But I don't drink alcohol. By the way, I thought smoking mostly affected the lungs.
Well, it's a common misunderstanding. Smoking can seriously harm the liver too. Research shows that heavy smokers can suffer from necroinflammation, which worsens liver health due to cell death.
Wow, I never knew smoking could affect the liver like that.
Yes, it can. Smoking is a major risk factor for worsening conditions like non-alcoholic fatty liver disease, or NAFLD. It accelerates liver damage by causing oxidative stress and worsening the disease. Oxidative stress happens when harmful molecules called free radicals build up in the body, damaging cells and contributing to liver disease.
So, smoking might be worsening my liver condition?
Exactly. Quitting smoking is vital for better liver health and slowing down damage. It's not just about the lungs. Your liver is also affected. Another concern is intravenous drug use, which can spread hepatitis C and other risks.
Hepatitis C? That's spread through blood, right?
Correct. It's a major condition often spread via contaminated blood, including through the sharing of needles in intravenous drug use.
What exactly are these intravenous drugs, doctor?
Intravenous drugs are administered via an IV and include antibiotics like meropenem and vancomycin, pain relievers like hydromorphone and morphine, antifungals like micafungin and amphotericin, and medications for low blood pressure like dopamine, epinephrine, dobutamine, and norepinephrine.
But Valerie doesn't use those drugs at all.
That's good to know, but it's still important to understand these risks. Even without needle sharing, intravenous drug use can harm the liver through dose-dependent toxicity.
What's dose-dependent toxicity?
It means the more you use a drug, especially something like acetaminophen, the higher your risk of liver injury. Overdosing can also lead to harmful molecule buildup in the liver.
So, basically, legal drugs can be dangerous if misused.
Exactly. It's not just illegal drugs. Misusing over-the-counter medications can also cause serious liver damage.
Interesting.
Do you know that eating out can also affect your liver health? Since non-alcoholic fatty liver disease is what you have, diet plays a big role.
I do eat out a lot. Is that really harmful?
Unfortunately, yes. The trend of eating large portions at restaurants, especially buffets or places offering all-you-can-eat options, has contributed to the increase in NAFLD cases. These eating habits lead to excessive caloric intake and subsequently obesity, which is closely linked to liver disease.
So, portion control matters then?
Absolutely. It's not just what you eat, but how much and when. Irregular eating patterns, like late-night eating, skipping breakfast, or eating quickly, can lead to obesity and liver damage.
I've heard eating a lot before bed is bad too. Is that true?
Yes, it is. Night eating syndrome, or NES, involves excessive calorie intake after dinner, potentially causing obesity and diabetes. Skipping breakfast can lead to overeating throughout the day, while eating quickly may prevent your body from signaling fullness, causing you to also overeat.
I see. I need to reconsider my eating habits then.
That's a positive step for your liver and overall health. Making mindful changes in your diet and eating habits can greatly reduce the risk of liver disease. Now, let's discuss sleep. How often do you manage to get a good night's rest?
Honestly, doctor, my sleep schedule is inconsistent. Some nights I sleep well, but other nights, I'm like an owl. I don't sleep much.
Getting enough sleep is important for maintaining liver health. Poor sleep can lead to fat accumulation in the liver, affecting its function.
Really? I thought sleep was just about feeling rested.
It's more than that. The liver is vital for digestion and immunity. Lack of sleep can lead to fat buildup in the liver, causing diseases like NAFLD and cirrhosis.
So, how does sleep exactly affect the liver?
Our bodies have a natural sleep cycle closely linked to liver functions, like metabolizing food and regulating blood sugar. Inadequate sleep disrupts this liver clock, leading to fat buildup.
That sounds serious. What can I do to improve my sleep?
Simple habits can make a big difference. Try to maintain a consistent sleep schedule, create a sleep-friendly environment, and avoid screen time before bed to help your mind relax.
I'll definitely work on that. I didn't realize how important sleep was for my liver.
It's an essential aspect of overall health. In fact, good sleep habits can reduce the risk of liver disease by up to 29%. It's all about caring for your entire body.
Wow.
Another crucial topic is the use of the common over-the-counter painkiller, Tylenol. While it's easy to get, high doses can be toxic to the liver.
I use Tylenol for headaches. Is it really that risky?
In moderation, it's safe, but in high doses, especially for chronic pain, it can be dangerous. The maximum safe daily intake is 4,000 milligrams, which is about 8 Tylenol tablets. Anything more can harm the liver or even lead to death.
That's eye-opening.
Indeed, just 7,000 milligrams, or 14 extra-strength tablets, can cause severe liver damage. That's why the packaging, especially for children's Tylenol, is designed to be difficult to open, to prevent accidental overdoses.
So it's that easy to harm your liver with something you can buy over the counter?
Absolutely. Always read the labels, and when unsure, consult a healthcare professional. Now, let's discuss something positive. Exercise. It benefits your entire body and plays an essential role in liver health for 3 main reasons.
I've been trying to get more active. How does it help exactly?
First, exercise increases fatty acid oxidation and decreases synthesis, preventing damage to liver cells and mitochondria, making your liver function better and protecting it.
That sounds important. What's the second reason?
Exercise enhances insulin sensitivity, reducing excess sugar delivered to your liver and managing conditions like diabetes and high blood sugar.
And the third reason?
It boosts lymphatic flow and detoxification through sweat. To reap these benefits, exercise should be intense enough to make you sweat and long enough to engage your muscles.
How often should we exercise then?
Aim for 3 to 5 sessions weekly, each lasting 20 to 30 minutes. This routine will significantly enhance your liver's health.
Thank you, Dr. Reyes. I feel like I have a clear plan to improve my liver health now.
You're welcome, Valerie. Just take it one step at a time. If you have questions or need support, don't hesitate to reach out.
Thank you, doctor.
The best way to help reverse your fatty liver disease quickly is a healthy lifestyle and a healthy diet. You should aim to lose at least 10% of your total body weight, but even a loss of 3% to 5% can improve your liver health. And you should avoid unhealthy foods that can cause fatty liver disease, as Professor Julia told you. I will assess your progress during your next hospital visit.
I am motivated.
If you like this video, please share, subscribe, or watch more videos on liver disease next.